stacked on top of each other. So that's your starting position here. The back should be fairly flat, not rounded, or not hyperlordotic either. So you want to get this kind of, nice surface to work on. Yeah. So we're going to work on the superior side of the spine. Okay. So this is this should be above the spine. So don't go below it. So spine is there. You're going to be on the superior side of it from this position, or the right hand side only. So you apply a bit of juice in there. Not too much.
No.
He's letting dancing's coming out of him.
That's the other movie.
That's the other movie, yeah.
Get mixed up.
Okay. You're right. Yes. What I'm going to do here is I'm going to use my palm, the back of my hand, should I say, just lock it from here. I'm going to move across that way. So the hand is actually going to be flat. So that's what you see. It's not you're not using a fist, you're not using your fingers. And this, if you think about it, this is how you pick up a glass, or to eat or whatever, drink. Okay, so this is neutral for you all the time. And you do that. Okay, so that's a neutral hand. If you ever get stuck in a cast, if you ever get hurt, anybody's been in a cast for the hand? That's your normal position. That's neutral. So you always work from the point of ease neutral. So my hand's neutral. And that's my technique. So, and you try to grip with everything. So don't stick your fist into the person. So you work with the closest hand to the body. If I see you working with this one, you're wrong. Because your hand buckles that way. So it's trying to do that. That's incorrect. But I see somebody doing that for sure. So the closest hand works. Your body's always facing the patient as well. Okay. A lot in classes and things I see is people actually somehow facing. You're doing it that way, but usually you're facing opposite direction to the patient. So I don't know how to do that, but somehow people manage to do that somehow. So you're always facing the patient. So facing the patient, the closest hand does the work. Just stand away a little bit and drop your elbow into your waist. And the only thing that does any work is your legs. So basically without even touching her, that's what I'm doing. That's the movement. So there's no strength required from the upper body. All you have to do is bend that front knee, and your technique is done. So the only thing I do is hold it there a little bit, lock it onto the area I want to work on, and slowly apply, slow, relax. My other hand is just stabilizing it so it doesn't slide off.
How's that going? Using your left thumb to assist with a little bit of pressure?
It's just really to stabilize me so I don't run off the... Okay, who's that going?
Close-up camera work.
So again, just this thumb here just stabilizes my hand there. So, and all I'm doing really is bending the front knee. That's all I'm doing.
So you're working on the fascia?
Oh, on the whole muscle.
On the whole muscle.
Yeah.
Feel it stretch away from the spine.
So it's really nice. This is good if you're actually also working on somebody that's got a bit more bulk. A football player as well, or so you can work on anybody. It's nice because you're using your body. You don't have to dig into, and also you're not sort of creating a hyperlordosis in somebody laying on the table, digging into them. So this is really easy to do. So lock on the sacral area. Put your hand there. Tuck it into your waist. This is nice and straight, and this stabilizes you a little bit.
Yep, and thumb on the palm.
Thumb the palm there.
Yep.
And off you go, and just relax into it.
That'd be nice for a pregnant woman, I imagine.
It's anybody.
Ah,
Yeah.
yeah.
How's that feeling?
That's
Pretty easy?
good, yeah.
You can go the other way as well if you like, so you can see it from that side.
Where are you finishing the move?
Just somewhere in the sort of thoracic area there.
Yeah,
Yeah, not as far as the scapula, just
T12 or something around there.
somewhere around there, 1, 2, yeah, sort of. Oh, sorry, the last couple of thoracic, I mean.
Yeah.
So I start from here again. I could do it the other way around as well. Kind of work that way.
So if someone had a very small waist and you're getting a bow in their spine, would you support underneath with a pillow or a towel?
No, actually, all I really want, the one bow, if I put this down here, you just apply a little less force, that's all. Yeah. But if somebody's a little bit smaller, it's not a problem.
And what's about a pillow between the knees?
You can if you want, if they've got a lot of problems, or if this is aggravating them, I'd put a pillow there, yeah. For comfort, you would probably put a pillow between your knees there, yeah. But as long as you make sure this is straight, hasn't gone backwards, you got to make sure that's not forwards, it's twisted to the spine as well. So everything is there. Some people actually with low back pain, yes, they like a pillow between the knees, or something there. So that one's nice and easy, isn't it? All you have to do is actually bend the front knee, and the work is done for you. The second one is going to be coming downwards, so you can actually lock onto the erector grouping again, but from top to bottom, so or from lateral to medial. So if I find the iliac crest here, then if I go next to it, and I just allow myself to get a grip onto the area, and just slowly slide. I'll show you on both sides. I can use my left hand and right hand.
Lucky you.
Yeah. Go down. Nice and slow. Again, lock on the area there. Place your hand there. Fingers relaxed. No fist, just relaxed. And
just using the back of the hand.
yeah, that's all. Just see, also making sure you get a grip before you even start. If you got too much oil, you'll slip. What we do is we get what we call a tissue lockup, so the tissue locks before you even start. And that's what I want to do with this. I lock the tissue. Once I've got locked the tissue, that's my starting point. So then I just drop downwards a little bit. I'll just show you with my other hand in a second, a bit higher up. Try not to hit the spine when you cross it over. So if I'm coming from the other side, I'll just do it with this hand now. I can do it either hand, doesn't matter. So you can see from this side. So there it is there. There's the erector grouping. I lock onto it. And you got to lock up.
That's good.
And then what I do then, of course, I just drop through there. Nice and slow. The slower the better.
You wouldn't have to worry about the oil, would you?
You know,
Just a little.
tiny bit. If you've got too much oil, you'll be working much harder to try to keep your grip. No, this one here, just using my body weight. I'm just sinking through it. I could use it if I have to, but I just let my body into the area.
Jillian, how's that feeling?
It's a lot more pressure than I thought it would be, and you can really feel the muscle stretching.
So you're stretching it lateral to medial, which is also very nice because very seldom you get techniques which actually they're always coming from the center
Yeah.
laterally. Like we did the last one, we did most of the pressure came from medial to lateral. This is coming from lateral to medial, so you're borrowing tissue back into the center, and that's what's nice about this technique as well. There's a lot of techniques used in osteopathy, and they use a lot of techniques pushing back into the spine. So this is one of these that we push back in towards the center.
It's really making a grid on the muscle, isn't it? Like cross every...
Yeah, so you work this way first and you lengthen a little bit, and then of course we work across and open it up from different directions.
Does pushing medially, does that also get the nervous system going? Pushing towards the spine?
It just, I don't know, it just stretches it. Remember when we showed you yesterday cutaneous nerves coming out through here? This is a really nice stretch for these guys which are being pulled perhaps that way. So it releases the tissue back in the opposite direction. So it gives you more flexibility through the area.
So you can come right down.
You look from that area there. Yeah.
So not into the quadratus lumbar?
No, we got it later. Yeah.
Okay.
Quadratus lumbar is down here somewhere.
Yeah.
So you can't
So I was thinking that would be nice too.
Yeah, but we're not getting into that. We can't get in there.
Kidneys
There's no room.
in that position.
No. So I have to change the position for that one. I'll do that one afterwards anyhow. But I just want to do this one first. So this is a really nice one for most people. So go back to the beginning. That's the first one. Just move the knee, nothing else. So I should be seeing this. Remember?
Micro
You
exercise.
got to look after yourselves for a start. Or you should be doing that. Twisting through your own spine. So it's just a matter of keeping this at an angle, affects the way you're going, and you protect yourself. It's just only a small movement. It's not a big lunge. You don't have to get down on your knees. And this one here is pretty straightforward as well. It's just a matter of letting your body weight go through you. If your table's too high, of course, that's your problem. Okay, so try those two. They're quite nice. You can have the other side done.